Diabetes is a chronic health condition that affects how your body turns food into energy. For someone with diabetes, either the body does not produce enough insulin or cannot use the insulin it makes effectively, leading to high levels of sugar in the bloodstream. Common symptoms include excessive thirst, frequent urination, extreme fatigue, and blurred vision, which can be subtle at the onset of the disease. Treatment for diabetes often involves a combination of medication, such as insulin or metformin, and lifestyle changes, including diet and exercise. Risk factors for developing diabetes include genetics, obesity, lack of physical activity, and poor diet. Here's a dive into the detailed aspects of the disease to understand how it can impact lives and what steps can be taken to manage it effectively. Symptoms and progression of diabetes. Diabetes, a chronic metabolic disorder, is characterized by the body's inability to properly use or produce insulin, leading to elevated blood glucose levels. Initial symptoms can be subtle, such as increased thirst, frequent urination, and unexplained weight loss. Over time, high blood sugar can cause more severe issues, including vision impairment, slow wound healing, and nerve damage, which may present as tingling or numbness in extremities. If left unmanaged, diabetes progresses and could result in life-threatening complications such as kidney failure, heart disease, stroke, and lower limb amputations. Understanding these symptoms is crucial for early detection and prompt management to mitigate progression. Diagnosis of diabetes. Diagnosing diabetes hinges on blood tests that measure glucose levels. Key tests include the fasting plasma glucose test, which assesses blood sugar after an overnight fast, and the HbA1c test, providing an average blood glucose level over the past 2 to 3 months. Another important diagnostic tool is the oral glucose tolerance test, where blood sugar is tested after fasting and again 2 hours after consuming a glucose-rich drink. These tests can confirm if a patient has diabetes or prediabetes, aiding clinicians in prompt intervention. Early diagnosis is crucial to manage blood sugar levels effectively, prevent complications, and maintain quality of life. Cause and risk factor of diabetes. The primary cause of diabetes varies by type, but both genetics and environmental factors play pivotal roles. Type 1 diabetes is an autoimmune condition where the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Environmental triggers, possibly including viruses, are believed to contribute to this autoimmune reaction. Type 2 diabetes, on the other hand, is strongly associated with lifestyle factors and genetics. Obesity, physical inactivity, poor diet, aging, and family history are significant risk factors. Insulin resistance, where cells fail to respond to insulin effectively, often sets the stage for type 2 diabetes, leading to elevated blood glucose levels. Additionally, ethnic background and a history of gestational diabetes can increase the risk. Treatment and management of diabetes. Effective treatment and management of diabetes hinge on a combination of lifestyle modifications, medication, and regular monitoring. Lifestyle changes, such as a balanced diet rich in fiber and low in simple sugars, and regular physical activity, can significantly help control blood sugar levels. Medications, including insulin therapy for type 1 diabetes and various oral drugs for type 2, are tailored to individual needs. Continuous glucose monitoring, CGM, and fingerstick tests allow for real-time tracking of blood sugar, ensuring adjustments can be made promptly. Moreover, patient education on recognizing hypoglycemia and managing sick days is crucial for preventing emergencies and long-term complications like neuropathy, retinopathy, and heart disease.